Our first, we're going to record the meeting today. So the theme for our meeting today is educating and empowering our tribal communities. My name is Sarah Zdunek, and I'm a public health project coordinator at the National Indian Health Board. And I'm joined today by Carrie Joseph. She's the Deputy Director for our Public Health Policy and Programs Department. And then we do have two speakers with us today, Mary Weston and Nicole Lomay from Intertribal Council of Arizona and the Banner Alzheimer's Institute in Arizona. So I will formally introduce them later before their presentation. So let's begin. Just an introduction to the National Indian Health Board, if you are unfamiliar. Our purpose is to advocate on behalf of all federally recognized American Indian and Alaska Native tribes to ensure the fulfillment of the trust responsibility to deliver health and public health services as assured through treaties and reaffirmed in legislation, executive orders, and Supreme Court cases. And our mission statement is one voice affirming and empowering American Indian and Alaska Native peoples to protect and improve health and reduce health disparities. So just a quick rundown of the agenda for today. I'm going to talk about purpose of the learning community and some meeting expectations. And we'll do some icebreakers and introductions. We'll split up into small breakout rooms just so people can introduce themselves, get to know each other before we start. Then Carrie and I will do a quick sort of brain health refresher 101 just to get our mindset in brain health and ready for our presentation then from Nicole and Mary. And then afterwards, of course, we'll ask for questions and do some discussion. And if we have enough time, we'll do some longer breakout rooms, but definitely we'll do a quick couple breakout rooms just for some reflection and some networking time. And then there will be some closing thoughts. So just a reminder, the purpose of our learning community is to serve tribal members and health professionals in their efforts to address Alzheimer's disease and dementia. And we're focusing on the roadmap for Indian country, which we'll introduce or talk about more later. That's sort of the guiding focus for the learning community. We also want it to be for tribal members and health professionals to share best practices or discuss barriers they're experiencing, just sharing information with each other. So just some expectations we have for the meeting. Of course, we want the environment to be safe and welcoming and always respect tribal sovereignty. We're going to invite tribal voices to speak first because our learning community is here to serve tribal members, but I want to remind everyone that everyone is welcome, non-tribal government, anyone is still welcome. We're just going to invite tribal voices to speak first. Also want to acknowledge all experiences are valid. It's a non-judgmental space and everyone has unique experience with things and want to respect that. Also, remember to sort of share the talking space and listen. If you feel like you're dominating the conversation, maybe step back and allow others to speak as well. And then just a couple sort of housekeeping things. Remember to stay on mute when you're not talking to avoid background noise and any sort of disruptions. And then during the question and answer portion, after presentation from Mary and Nicole, I'll ask you to raise your hand when you want to speak and then you can unmute, just so there's no interruptions or overlap. So for a little bit of an icebreaker, we like to do this and ask people where they're joining from. And you can actually, using the annotate feature on your computer, it should be in the middle of the screen. It'll say view options. You can select a stamp and actually put it on the map. So I'll put mine down and then walk through again. So I'm calling in from DC. It's like right there. Oops, it didn't work. Or it's a little off, but can everyone see it? Yeah. So, okay, good, great. Everyone figured it out. I see. That's great. We have all over the country: Wisconsin, North Carolina, Arizona, New Mexico, California, Oregon, Washington, up there, Massachusetts, New York. Okay, so I see Tom said he doesn't see the option. He'll note Oklahoma. That's great. I'll just, let me explain again. It should say view options in the middle, and then there'll be a button called annotate. It's got a little pencil marker. And then you can select stamp or draw text as different things. But stamping is the easiest for this. Okay, see some more people. We have a lot of people in New Mexico today and Wisconsin. I'll just note in the chat, some people added some things. Kimberly is coming in from Minnesota, Teresa in Phoenix, Roxanne also in Arizona, Macrina's in New Mexico, and Mary Wolf is in northern Wisconsin. It's great. It's always nice to see where everyone is coming from, and all the different perspectives we'll hear, talk to people from all over. Okay, I think has everyone gotten in that wanted to? Okay, Betty just added in your main, I think. All right. So after that, now we'll do some just more personal introductions. I'm gonna split everyone into breakout rooms just for a couple minutes, about 5 people per breakout room. So you can introduce yourselves, just say hello, maybe what your role is, where you work, again, where you're maybe calling in from. Just give me a moment, I will. All right. So I'm going to do the breakout rooms now and then call you all back in about 2 to 3 minutes. Those still in the main room, are you having any difficulties accessing the breakout rooms?
Hello, my name is Charlene Palache. I work with the Pueblo Poaque CHR program. I also we do a bunch of classes with nutrition, exercise, and hello.
Hi,
Hello?
we're actually back
Oh,
in the
sorry,
main room. Can you hear me? We're actually out of the
sorry,
breakout
I
rooms
got cut
now.
off.
No, it's
Oh,
okay. Okay, I think everyone is back now. Was that enough time for everyone to go around, or you think we needed maybe another minute or two?
We had just enough time.
Okay.
There was only 4 of us.
I'll add another minute then. So we're going to do this one more time, and hopefully I believe it's going to randomize again. If it doesn't, just I guess we can just introduce a little bit more. But so I'll do a couple, like 3-4 minutes then, just so we can meet more people in the group. Let's see. All right, it looks to me like it's going to be different rooms, so I'm going to open the rooms again. For those who have joined us just now, we're doing introductions in breakout rooms. So all right, welcome back, everyone. Just wait a minute while people join back in. Okay, I think everyone is back. So I hope that was an enjoyable activity. And it was nice to meet everyone. Oh, here we have some more people coming in. Just give a minute. Okay. So moving on from introductions, we're going to go into just that sort of brain health refresher for everyone. So just some important terms to remember, refresh our memory. Brain health, what are we talking about when we say brain health? Your thinking, understanding, and memory abilities, but also could be things you do to keep your brain healthy and active. And then cognitive decline, which is not a diagnosis, so not mild cognitive impairment or cognitive impairment is a diagnosis. Cognitive decline is just description of what someone's experiencing, and that would be confusion or memory loss. Dementia is just the general term for the impaired ability to remember, think, make decisions. And the important part of that is that it interferes with a person's everyday activities. And then Alzheimer's disease, dementia and Alzheimer's disease get used interchangeably a lot, but Alzheimer's disease is a form of dementia. It can progress from mild memory loss to being unable to hold a conversation or live independently, have awareness of one's environment. And then lastly, as I mentioned, mild cognitive impairment, which is a diagnosis, and it refers to cognitive changes that are noticeable by either by the individual or by close friends and family maybe. It doesn't affect the person's ability to carry out activities, but it's a noticeable cognitive change, and it may or may not lead to dementia. So then I'm just a reminder of the different types of dementia. It's just a pie chart of prevalence. So Alzheimer's is the most common at 62%, causes problems with, like I said, memory, language, and reasoning. And then second is vascular dementia, which is linked to heart disease and stroke. So having heart disease would increase your risk or likelihood of developing vascular dementia. And it's related to impaired judgment, difficulty with motor skills and balance. And then you can see some of the other ones. I'm not going to go into super descriptive about those, just mixed dementia, dementia with Lewy bodies, frontotemporal, and Parkinson's disease. So dementia is a lot of different things. It's not just one disease like Alzheimer's. Like I said, a lot of people will use it interchangeably, but as you can see, it's a lot of different things. This is just another picture just to show just changes that happen from a healthy brain to a brain with Alzheimer's disease. I'm not going to go into the science either behind this one, but just to remember that there is some physical changes happening in the brain. It's shrinking, as you can see, in comparison to the healthy brain. So also important to remember some modifiable risk factors. So these are things that increase your risk of developing dementia, but in theory, you could change these things, or they're part of exposure environment. So some of these are traumatic brain injury, exposure to air pollution, later in life, excessive alcohol use, less education access, hearing loss, hypertension, obesity, diabetes as well, smoking or commercial tobacco use, depression, social isolation, and lack of physical activity and exercise. And then also important and sort of related to what we're going to talk about today, which is educating and empowering community members. So one thing you would want to talk about is some signs of Alzheimer's disease and related dementias. And so some of these, there's 10 common ones. Memory loss, that again is disrupting daily life. It's an important part of that. Challenges in planning or solving problems, difficulty completing familiar tasks, confusion with time or place, trouble understanding visual images and spatial relations, new problems with words and speaking and writing, misplacing things, poor judgment, and then withdrawing, isolating yourself from work or social activities, and then significant changes in mood or personality. So now I'm going to hand it over to Carrie. She's going to talk about dementia in American Indian Alaska Native context, and more specific to our tribal communities.
Thanks, Sarah. Well, I guess first of all, we know that we don't have a ton of data, right, for American Indian Alaska Natives. And we also know that dementia is underdiagnosed. So we're going to try to provide some context and scope. So if you can go to the next slide, Sarah. So we know that the Native population in the United States is growing. It grew 27%, 3 times faster than the total US population from 2000 to 2010. It's expected that the number of American Indian Alaska Natives aged 65 and older living with dementia is expected to grow over 5 times by 2060. This is also, so just the folks 65 years and older is expected to triple over the next 3 decades, but those 65 and older with dementia is expected to grow over 5 times. We know that American Indian Alaska Natives are living longer, which is good, having longer lifespans. So just with the growing population, growing older population, that it's expected to have more folks showing signs of dementia. Next slide. And just talk about some of the disparities. In 2015 to 2018, 1 in 5 American Indian Alaska Natives, 45 and older, self-reported difficulties in memory or thinking, which is termed cognitive decline, compared to 1 in 9 of the general population. So people are recognizing and reporting some difficulties with memory. And according to a California study, 1 in 3 American Indian Alaska Native elders, 65 and older, are projected to develop dementia. And as I said before, the number of those 65 and older living with dementia is projected to grow more than 5 times. So we know this is an increasing issue, and we know that, being public health folks, looking at a public health approach from a comprehensive point of view to be able to reach, and really address the issue is what's needed. Next slide. As Sarah mentioned, diabetes is a risk factor for dementia, and we know that Native folks have the highest diabetes prevalence rates of all racial and ethnic groups in the United States. 1 in 6 adults, American Indian Alaska Native adults, has been diagnosed with diabetes, and that's more than double the prevalence rate of the general U.S. population. So knowing that that's a population that we have lots of programming for, and there's been a lot of effort to address diabetes, but knowing that it is a risk for Alzheimer's and related dementias. So going back to kind of the public health approach for dementia and Alzheimer's, this is the front cover of the roadmap for Indian country, and it was the first ever public health guide focused on addressing dementia in Indian country. It was an initiative, part of the Healthy Brain Initiative through the CDC and the Alzheimer's Association, and they worked also with the International, I squared, I'm going to get this wrong, International Association for Indigenous Aging, and worked with those folks to connect with people in Indian country to develop this roadmap. Input was received from experts and practitioners, tribal health directors, tribal leaders. Within the roadmap are 8 public health strategies for communities to consider when addressing dementia. Next slide. So we're not gonna list out all the strategies, but we are gonna talk about these first 3. So when we were designing the brain health learning community around the different roadmap strategies, the first couple of learning communities we're gonna focus on educating and empowering community members. This is kind of the big category that houses the first 3 or 4 strategies. So today we're looking at strategy 1, which is, and this is direct wording from the roadmap. Work with community members to understand brain health, early warning signs of dementia, and benefits of early detection and diagnosis for persons with dementia and their caregivers. So strategy 1 is really about increasing knowledge. Strategy 2, encourage community members to use effective intervention, best practices, and traditional wellness practices to protect brain health, address cognitive impairment, and support persons with dementia and their caregivers. Strategy 2 is really about motivating and using best practices or traditional wellness practices. And then strategy 3 is to provide information and tools to help older adults with dementia and their caregivers anticipate and respond to challenges that typically arise during the course of dementia. So that's all about resources and tools and things folks can use. So those are the 3 strategies we try to focus this first learning community around.
So now it is time to hear from our speakers, Nicole Lomay and Mary Weston, and I'm going to just provide a brief introduction for them both. So Nicole Lomay is the Senior Outreach Program Manager for the Native American Outreach Program at Banner Alzheimer's Institute, which is in Phoenix, Arizona. She's responsible for setting up a new standard of care for dementia patients and their families by raising awareness about dementia, evaluating culturally sensitive cognitive assessment, bringing brain health programs, and identifying the types of education outreach activities that meet the unique needs of the Southwest tribes. So Nicole completed her Bachelor of Interdisciplinary Studies with an emphasis on sociology and Native American Justice Studies from Arizona State University. And she has extensive experience working with the Native American community and community-based programs through the work she's done as a Native American coordinator an urban school district, facilitating Native American support groups for federal program and as a case manager for the state of Arizona. So thank you, Nicole, and welcome. We can't wait to hear your presentation. And we also have Mary Weston with us. She serves as the Area Agency on Aging Region 8 Program Manager, which is at the Intertribal Council of Arizona, which is also in Phoenix, Arizona. Ms. Weston is a master trainer for several evidence-based programs, the Chronic Disease Self-Management Program, the Diabetes Self-Management Program, the Powerful Tools for Caregivers Program, and she's a certified REACH VA coach. Her experience in Arizona includes working as the Elderly Services Program Coordinator with the Gila River Indian Community, also as a Family Caregiver Support Coordinator with the Intertribal Council of Arizona, and also as a Caregiver Coordinator for the Salt River Pima Maricopa Indian Community. And finally, as a Foster Grandparent Program or Senior Companion Program Director, the state of Arizona Aging and Adult Services. So really wonderful background. Prior to coming to Arizona, Ms. Weston lived with her family in Alaska for 12 years. She worked for the state of Alaska providing social services to tribal communities. And in addition, she served 20 years with the Department of Defense providing social services to military families. So with that, I'm going to share their presentation. Right. Is that good? Everyone can see? Right.
Good afternoon, good morning, good afternoon, depending on where you're located. This is Nicole Lomay. Thank you for the introduction, Sarah. Go ahead and go to the next slide. So just to give you a bit of historical background of the Native American Outreach Program, this program actually began in 2003 as a Native American project at Sun Health Research Institute in Sun City, Arizona. The Native American project then transitioned in 2008 to Banner Alzheimer's Institute in Phoenix, Arizona. So the goals for the program was to increase knowledge and awareness of Alzheimer's and dementia among the Arizona urban Native American communities and Arizona Indian tribes, and also to offer a study opportunity for people who have either normal memory or memory loss issues. And the purpose of the study was to understand changes associated with normal aging and memory impaired individuals in the Native American population. And the outcome that we wanted to see was to improve healthcare related to dementia for the Native American population. Next slide. So throughout the years, Banner Alzheimer's Institute's Native American Outreach Program has developed materials, trainings, and events to provide education around Alzheimer's disease, dementia, and brain health. And here are some of the materials and training events that tribal communities have received. So we developed a book called Navigating Through Memory Loss. What I liked about the book was that it answers questions caregivers have about caring for someone with Alzheimer's disease. And here are some of the questions that are discussed in the book. What is dementia? What are common triggers of problem behaviors? How do I prevent my person from wandering? Why is my person resistant to bathing? When is it time to stop driving? And so our second edition of this book includes all this information, but it also includes information about caregiver health. It's called Taking Care of You, Self-Care for the Caregiver. And we felt that caregivers needed extra support and information to take care of themselves. We do have an annual statewide conference and pre-conference on Alzheimer's disease and dementia. The pre-conference is actually for professionals that do come in and receive some training. We do have a Native American toolkit that was developed on Alzheimer's disease, and this toolkit and training program is designed to meet the ever-changing needs of both community members and professionals. We do offer information about Dementia Friends. And then also we do provide information about brain health. Some other things that we have developed are what we call care tips. And these are actually short, practical tips that address some of the common challenges caregivers face and providing some simple solutions to address the situation. We did develop a Beacon newsletter, and this newsletter offers some practical advice and tips on to improve living with Alzheimer's disease. And then we had listed online courses and dementia dialogues, free monthly webinar offering the opportunity to hear from experts on a variety of topics. We've also provided presentations to tribal communities at various events. We have provided CME and CEUs to doctors, nurses, and social workers at tribal clinics and hospitals. And we did provide a National Native American Conference on Alzheimer's disease and dementia in 2015. Next slide. So since the pandemic began last year, we had to kind of pivot and rethink how to continue providing information and support to tribal communities. Out of respect for the health of our seniors and the tribal communities we serve, we decided not to travel. Instead, we've been working on new material and programming that we can provide virtually and then ship out new collateral information. So each community is different, and by talking to them about their tribal programs and communities they serve, they have made many adjustments during this time of the pandemic. Presentations and outreach activities are limited in tribal communities at that time. So there's been a change in their programs that provide services to their seniors and caregivers. So in response to these changes, we've had to make some adjustments to continue the flow of information and support to tribal communities. Some of the things that we have developed, we developed the Native American Caregiver Circle Group, and this was created to provide support and information to caregivers and families and professionals that serve the community. And this group, they discuss an Alzheimer's topic that provides strategies for caregivers of people with memory loss through Zoom. We started this particular group by phone because many tribal communities have problems accessing the internet, or there's no access at all in many remote communities. So we decided to move this format to Zoom because it provides a virtual link along with a phone number to call into, so that some of our professionals that have access to the internet and can have access to this through work would probably be more engaged if they could see us. So we were thinking about them when we decided to move this to Zoom. So this group continues to grow, and it's actually accessible nationwide. The Native American Beacon e-newsletter actually provides a variety of topics and links about Alzheimer's disease and dementia, caregiving, brain health, classes, support groups, and other events. And there are more activities that are actually listed on this e-newsletter. So there's a whole bunch of information that is there and available. We are working with tribal communities to distribute our Beacon spotlights through through their Meals and Wills program or their meal pickup program. And these articles feature Alzheimer's information about caregiving during the time of the pandemic. And there are other articles that we provide to support them, to provide advice and tips to them. We also offer a virtual training for our Native American toolkit in Alzheimer's disease. So we were able to kind of branch that out. And so far we've had 2 trainings on this, and they were actually well attended. We did, however, postpone our annual conference and pre-conference until next October in 2022. We just didn't want to rush that. So at this point in time with our program, we're continuing to develop other materials and other ways of outreaching to tribal communities. Many tribal communities in Arizona are in different phases of opening up their community, and we respectfully wait for them to give us consent to provide more dementia and brain health information in person. So in the meantime, the flow of information and outreach does continue to these tribal communities. Next slide.
First of all, I'd like to say it's an honor to be here today. Thank you for inviting me from the Intertribal Council of Arizona. Thank you for Nicole for including us in on their presentation. It's been a privilege to work with Nicole and Banner, partnering and collaborating for the tribal communities in Arizona. I'd like to start out by sharing a little bit of information about the Intertribal Council of Arizona. The Intertribal Council of Arizona, ITCA, was actually established in 1952 to provide a united voice for tribal governments in the state of Arizona to address common issues of concerns. ITCA is actually governed by a board of directors that's composed of the highest elected tribal officials, chairpersons, presidents, and governors. And these representatives have a very comprehensive understanding of the needs and the conditions of Indian communities that they serve and bring that information forward. ITCA operates with more than 40 projects and grants and 60 employees, providing technical assistance and training to tribal communities in Arizona in areas such as program planning, resource planning, research, data collection, management, and evaluation. The Older Americans Act, established in 1965, was an important policy for elders. It opened the door for increased services for elders to become more independent at home and in their communities. The act also empowered federal funding to be given to communities to use for services and programs in their areas for supportive services for older Americans over age 60. At this time, the Area Agency on Aging, Region 8, became a designated agency during the Older Americans Act period. The Intertribal Council of Arizona Area Agency on Aging Region 8 was established in 1974 and represents 21 member tribes in Arizona. ITCA AAA administers the Older Americans Act programs for both Title VI and Title III through subcontracting with the tribes in Arizona. There are 17 tribes that actually receive funding from Title III grants, 17 tribes that receive Title VI funding from grants directly from the federal government, and that's the Administration on Community Living in Washington, D.C. And then there are 4 tribes that actually have come together as a consortia to work together to provide services in their tribal communities. Next slide, please. This is a map of the tribal organizations, the tribes served in Arizona. As you can see, it's across the board in the state of Arizona, north, south, east, and west. There are many regions that are served and provided services through the Intertribal Council of Arizona. Next slide, please. We wanted to share some information with you about the growing older adult population, and you've heard some about the growing adult population earlier. We wanted to share some information with you on the national level, the state level, and a little bit of information on the tribal community level. According to AARP, by 2030, 1 in every 5 Americans is projected to be 65 years and older. In Arizona, there are nearly 1.5 million Arizonans age 60 plus, according to the Department of Economic Security, Aging and Adult Services. And the American Indian Alaska Native population, according to the US Census in 2010, was 385,772 older adults. 5.4% of Arizonans are 65 and older. and they are American Indians. Over 800,000 Arizonans are family caregivers, and those populations are growing. From a tribal community perspective, ITCA AAA is serving and providing ombudsman program services to 2 tribal assisted living facilities that have 28 total beds, 4 skilled living facilities with 239 total beds. And in 1 year, over 134,000 Title III meals were served to tribal elders in Arizona by ITCA AAA through the tribes. Statewide, over 29,000 one-way trips were provided through the Tribal 3 transportation grant funding. What does this show us? It shows the increased need for services for older adults. It's only going to increase in the next 5 to 10 future years. It's important for us to focus on the services that are needed for chronic conditions, also to include the increased need for older adults with dementia and Alzheimer's, and the caregivers that are caring for them and their family members. Next slide, please. These are the AAA and tribal services provided through Title III, Title VI, and Title VII. Title III and Title VII grant funding is provided through the state of Arizona, Department of Economic Security, and Title VI grant funding is provided through the federal government, Administration of Community Living in Washington, D.C. Title III and Title VI services, as you can see, mirror each other in many areas. So we work to make sure that those services aren't duplicated, but are provided and available to tribal communities. It can certainly help to provide more services to each tribal community if a variety of grant funds are available. For Title III, you'll see where congregate meals are listed, home delivered meals, transportation, socialization and recreation services. These are all services that have continued to be provided during the pandemic. Caregiver support services, information and referral, training, respite services, and also disease prevention and health promotion services. And those include the chronic disease self-management program, the training, a 6-week training, diabetes self-management training, powerful tools for caregivers, and also for exercise and strength building programs, enhanced fitness. What did I leave out? For Title VII, the long-term care ombudsman program, the Tribal Long-Term Care Ombudsman Program is provided by our staff and staff also through the tribal community and the Pascayaki community. And those services actually serve residents, ensure that their rights are being upheld in long-term care facilities, ensure that they are receiving proper care and that their quality of life is as it should be in those long-term care facilities. And that could be in tribal communities or off tribal communities. Next slide, please.
So when we did the slide questions to kind of think about, we wanted to kind of talk about how our organizations have kind of collaborated along the way in providing information about Alzheimer's disease, dementia, brain health to these communities. So a lot of the programs that the Intertribal Council of Arizona does have really complements some of the things that we're actually producing for tribal communities around this disease. And so I thought it would be nice to kind of, for Mary and I to kind of talk about some of the questions that we have and to kind of share what our experience has been working here in Arizona. So the first question says, How have tribal communities responded to the information about Alzheimer's disease and brain health? So, when I started this position about 8 years ago, tribal communities had mixed reactions about talking about Alzheimer's disease and dementia. And, many tribes were very distrusting and some were not receptive to the information. So in other words, it wasn't a very popular topic to talk about. And so a lot has changed since that time. There's a lot of development of trust and rapport and, having those right connections in the community that have to kind of be nurtured along the way so that your program can thrive in the community. And so now that people are now discussing or talking about, they're asking more questions now about this topic. It's a real contrast to when it first started in the beginning. So there's more interest also in some tribal leadership here in Arizona, and they're willing to learn more. So I've been able to provide information about this to tribal council. So that has been a real pleasure to do. And right now is the opportunity to talk about Alzheimer's disease and brain health. They're both very popular topics now to discuss in the community. So it's really nice to see that all of these other programs and the focus on Alzheimer's and disease and dementia in various communities and even at the national level. With the National Indian Health Board, it's really refreshing to see that these programs are beginning to have that focus. But and that's something that's been a real pleasure to see. How about you, Mary?
So in working closely with Nicole and Banner in the two tribal communities that I had the opportunity to serve, some of the programs that were so helpful to the staff and community members. First of all, let's take the staff at senior centers and elderly centers. At the Gila River Elderly Services Program, we were able to get staff trained by Nicole with the toolkits for Native Americans. And that was so helpful for the case managers in working with the families in the community. Time and time again, they utilized the information from that to help with care planning, to help families to understand more about dementia and Alzheimer's and how to do family planning, how to put a care plan in place. Also, it was helpful to have information about dementia and Alzheimer's provided at caregiver conferences and also at elder conferences that we had at the community, in the communities, both in the two tribal communities I worked in. It's so important to reach out and provide awareness and education in a community-based approach. And that collaboration has made such a difference at the tribal community level and also at the ITCA level in working with tribes in Arizona.
Second question is, what challenges have families and caregivers experienced with Alzheimer's disease, dementia related issues and concerns? So what are the challenges? So some of the challenges that I still hear when I'm in the community, or I even get an email or a phone call from families that are still trying to figure out how to care for someone with Alzheimer's disease through trial and error. And so that's something that's still a challenge. Another challenge that I hear are families do not know the difference between normal aging and signs of a memory impairment. So in other words, they don't know when it's time to see a doctor. Many families are not familiar with their own tribe services or who to ask for help. So I know that Mary has seen her fair share of challenges working in these communities too.
I certainly have, and Nicole shared some of them. One of the challenges for rural communities is the lack of or limited transportation, medical services, home care-based services to assist with elders that are being at home and receiving care from their family members. Those supplemental services that are needed, that we talked about, that are offered under the Older Americans Act, they are not readily available sometimes in rural tribal communities, and that can be a challenge to help them with putting a care plan together. Also, taking a look at the caregiver stress level can be even additional stress in trying to provide and put a workable care plan in place. And then working with the education piece and the awareness piece of the family and the caregivers in rural communities is the same as in other communities, ensuring that they receive the training that they need to provide appropriate care for their loved ones in a home setting.
Hey, Mary, why don't you go ahead and read the number 3 question?
Sure. What resources are needed to help strengthen caregivers caring for loved ones with Alzheimer's disease or dementia in your tribal communities?
Oh, go ahead, Mary.
So working with tribal communities, several of the resources that I found and that we found through ITCA AAA that are needed, first of all, is awareness of dementia and Alzheimer's, awareness of the growing aging population, as we've certainly talked about here today. And that awareness needs to happen at the tribal leadership level first, and also with community professionals in the tribal communities. And that includes tribal social services, tribal leadership, of course, tribal social services, those community health representatives in your community that work so closely with elders and others, other professionals in the community, to include law enforcement, to include those in the courts, the judges and others that actually work and have to make decisions about older adults with dementia and Alzheimer's at some point. All of the community professionals can be and should be provided in an awareness and education program community-wide. And so we find that that is number one. And then also taking a look at the resources that are provided in the community and outside resources, and making sure that families are aware of those resources and can get information about those resources. Support groups are so important. Support groups, many times after we had the education and awareness in the community, for example, when Nicole would come to conferences and attend, we would have an opening up of families asking for help, asking for resources, because suddenly they realized they weren't alone and there were resources available.
So it's really key for, I think, families that have a person with dementia, that they really educate themselves on where these resources are, and to find and to become more familiar with the resources that are offered within the community as well, because there's a real gap there. And so it's just, sometimes I'll get these phone calls and people will be asking, and then I'll have to make phone calls out into tribal communities to get the information for this person. And so, there still needs to be work around this. We know that it is key for people that are in these tribal communities to really understand what Alzheimer's disease are, what are the struggles that caregivers are having to go through on a daily basis, because, oftentimes people tend to scatter. So, when there's a dementia diagnosis, then sometimes, relatives are not willing to pitch in. So we really need to do what we can to provide resources for our caregivers. So we try to come up with programs like our conferences, our pre-conferences for the annual training for our professionals in the community. All of these things kind of work together to strengthen resources in the community. So that's why we're always developing new things. Mary, do you want to read the fourth one?
Can you share any positive changes that have occurred in your tribal communities around AD, caregiving, or brain health. And that would be Alzheimer's disease, caregiving, or brain health. Do you have any positive changes that you could share with us today?
Yeah, so there have been some positive changes in tribal communities. Some communities have started talking circles to engage their seniors, and many have found that their seniors are using words like Alzheimer's disease and dementia correctly. So there's less confusion about the two words. They are also willing to have a conversation about it, and they're not as afraid of it as they used to be. There's more interest in brain health, and some are telling me they're making changes or creating small goals to lead a healthier lifestyle. Caregivers appreciate the advice about self-care and day-to-day care of their person with dementia. Professionals that work with these families day to day appreciate the materials, information, and training they receive. And this helps them support the families they serve in the community, because sometimes, they do run up against issues where they just don't know what to do. What can I do to prevent a person from wandering is always a popular question to ask. So we have to kind of sit back and kind of figure out what are some tools that are available to kind of prevent that. Here in Arizona, living here in the mid to southern Arizona can be very hazardous for someone to be wandering out in 115 to 118 degree weather. And so, it's people then, start to ask questions about what are some safety things that I can do to make sure that my person doesn't wander. And so, we're always available to answer some of those questions. So even in the form of an email, I do get letters too through the post office from rural communities about questions that families do have. So there have been a lot of positive changes that have occurred, because now people are identifying where the resources are and who they can contact. And so we try to make sure that we're always helping in that way. Have you seen any changes, Mary, in the communities that you served?
I think as I mentioned earlier, one of the tools that can really help, especially if you're providing case management in your organization, or just for staff in general that are serving the elder population and families, is the actual training, using the toolkit or training, learning about dementia and Alzheimer's, how to work with families, do that family planning, those care plans. Families really need help in recognizing what the needs are. Number one, recognizing that they need help and that what is going to work for them, what help is available, whether it's limited or more help is needed. And that's so important, because sometimes it's hard for family members to get to the point where they actually recognize that they need that help for their loved one with dementia, Alzheimer's. I think that's so important. Also, we heard from our Arizona Indian Council on Aging, those representatives, that they truly feel there's a need for more education and awareness in many of the tribal communities, that we need to start working towards that as the aging population grows. So that's actually coming from elder representatives statewide for us.
Yeah, so it's always nice to report out some of the positive changes that are occurring. So we're really happy to be able to articulate what those are. The last question is, how has collaboration around Alzheimer's disease and brain health enhanced education in tribal communities? And so, from the presentation that Mary did about all of the services that the Intertribal Council of Arizona does provide to tribal communities, a lot of those were able to kind of, our programs, our materials complement those services. And so, the collaboration that we've done together as an organization has been very successful. And so, collaboration brings services into tribal communities. It's very valuable. when we develop our materials or we're having to figure out our conferences, our pre-conferences, programs, we always use an advisory council for those. So it isn't something where we just kind of come up with an idea. We actually really sit down and we try to include the tribal communities that we serve and invite them to the table so that we can get some feedback from them. So, the Intertribal Council of Arizona, like I said, our program, we've always supported each other. Our events, we always go out if there's a referral, if somebody needs me out in the community, they tell me about it, vice versa. So that's how we're able to kind of keep track of the communities, because it's vast. I mean, things change really quickly in tribal communities. Someone could be working there and then all of a sudden they've left their position, and then you're scrambling to figure out who's this next person that you need to talk to. So it's always nice to kind of call over. If I'm not able to figure out who that person is, I'm able to call the Intertribal Council of Arizona and ask if they've been updated. So we really appreciate their advice and support, because in the end we're all working together to bring these good services and good outreach opportunities to tribal communities. What do you think, Mary?
Collaboration is so important, as Nicole mentioned, and I'd just like to add that also utilize your community agencies, collaborate with them, and first of all, approach tribal leadership and councils to bring them on board with a community-based approach to education, awareness, resources, and the need in your communities.
Okay, next slide, please. Does anybody have any questions? I think we saw one.
We did get one in the chat box, and I can read it. It's from Valerie. It says, what are the top needs for help that are requested?
Sarah, could you repeat that question again, please?
It's what are the top needs for help that are requested?
For health needs, health conditions? Oh, health needs.
Sorry.
Help needs with dementia and Alzheimer's, or dementia related disorders. Nicole, would you like for me to go first? I can.
Yeah, you can. Yeah, go ahead.
In working in the tribal communities, the top needs in actually providing case management directly to families of loved ones, to the elders themselves with dementia or Alzheimer's, and to their families. The top needs were part of what I mentioned earlier. First of all, recognizing what they're working with, the seriousness of it, understanding dementia or Alzheimer's better, understanding that even more changes will be occurring, and that a viable care plan is needed. Who's going to help? What many family members are working, some aren't. What's going to work for this family and this individual with Alzheimer's and or dementia? So the care planning, resources, durable medical equipment, those are all items that need to go in the care plan for that individual with dementia and Alzheimer's and the caregivers and family members. They really need help to put that together and tying into the resources.
So we have another couple questions from Piri White. What barriers are you seeing in tribal communities to accessing specialists like neurologists? If none, where are tribal members and caregivers finding these doctors?
So what our program does is we provide the training out in tribal communities, because there are not enough experts to provide a diagnosis of dementia in tribal communities. And so when we go out to provide this information, I usually take along our one of our doctors out. And so she provides the information to folks on a clinical level. And so, but, you know, even with the Phoenix Indian Medical Center, I think they have a neurologist, but I think that they do refer their patients out, I think, to Barrow's Neurological Institute. And so if they are not provided a service in the community, then they're referred over to the Phoenix Indian Medical Center, who refers them out. So that's as far as I have heard, that's what they are doing.
So we have another question from Betty John, and it's, is there a helpline for caregivers and families?
You mean a helpline specific for Native American caregivers and families, or for caregivers and families? They're just general caregivers and families.
Tribal or non-tribal?
There are hotlines that are available through the Alzheimer's Association that we usually have folks dial into if they wanted to get immediate help. You know, some of those national organizations do have that, but for the program that I have at Banner, we do not have a helpline.
So we do have a helpline available through ITCA AAA for elder emergencies, and that covers many areas. It's not specifically just for caregivers. It's for anyone who has needs assistance, needs resources, and that's available through AAA Region 8, and that's a 1-800 number, 552 9257, 1-800-552-9257. And we have put that in place through AAA Region 8 during the pandemic to provide assistance to elders.
Carrie has her hand raised, so go ahead and ask your question.
Yes, Nicole, in the beginning, and I think I captured this, you were talking about it sounded like a support group or and you said that was open to folks nationally. Could you, yeah, your caregiver circle group, you said it's accessible nationwide. Could you talk a little more about that, if that's a resource outside of your area?
Yes, so we provide that through Zoom, and it happens every second Thursday of the month. So it's Mountain Daylight Time. I think that's what we're called here in Arizona. But it happens every second Thursday of the month from 10 to 10:30, and it's a half hour. So what we do is we discuss an Alzheimer's topic, and so we can have caregivers on there, or if there are professionals that want to listen to the discussion so that they're learning more, you know, we have that available.
Okay, thank you.
You're welcome.
There's one other question in the chat box. Have you any successes with hospitals for diagnosis?
What was that question again?
Have you had any success with hospitals for diagnosis?
I can speak from in working in tribal communities through case management that it can be a challenge working, hearing from the families who are trying to get a diagnosis through the medical side. And what can help is communication from caregivers and family members when meeting with the medical side. it can be quite a journey sometimes, depending on what the medical side is actually seeing physically and mentally that's going on with that particular elder at the time. However, input from the family can help. Also, again, the community-based education in tribal communities, it would be really good to focus on the medical side and invite them to attend. Just as a refresher, as a reminder of the signs, what to look for, checklists, those kind of things, what to listen for when working with families. Sometimes that can be very helpful as a refresher. And that's actually one of the, I'd like to mention too, one of the areas that we touch on in the training that we do with caregivers and family members in the community with two of the evidence-based programs where we actually talk about communication with physicians and PAs and nurses and how they can better communicate with them the needs of their loved one with dementia, what they feel might be dementia or Alzheimer's with that loved one.
Okay, thank you, Mary and Nicole. We have about 10 minutes left in our meeting, so I wanted to allow some time for us to do breakout rooms again. Give me one moment.
And while Sarah's getting that set up, the National Indian Health Board currently has a funding opportunity for a small amount of funding, basically for tribal communities to address Alzheimer's or dementia. And after we do these breakouts, Sarah's going to tell you more about that. So I just wanted to let you know that that's coming up.
So we had some sort of prompting questions, but because we don't have too much time, don't feel the need to discuss these questions if you have other things you want to talk about with other people. But just thinking about after these presentations, best way to share information in your community, maybe some things to be mindful of, thinking about introducing things in your community and then maybe anticipating some barriers. I'm going to go ahead and do breakout rooms. One of each of us will be in the breakout rooms as well. Oh, I'm sorry. I did one too many rooms. Okay, just one moment. Okay, I'm going to open the rooms. So wait for everyone to come back. I'm sorry we're going over time a little bit, but I did want to give people time to talk about things a little bit more.
That was great. Thank you for giving us the extra time.
Yeah, so I know I don't want to keep people from other things, so I'll just very quickly wrap this up. Just wanted to mention our funding opportunity, which is, we talked about this during the presentation, or Nicole and Mary mentioned partnerships a lot. So that's something we're emphasizing, is partnering with other tribal or an IHS program, any health related program. And it's going to be $15,000 for 12 proposals. So that is the link there. I don't know if Carrie is here, she can put that in the chat quickly, or after this webinar or our community meeting. Oops, I'm so sorry. I'm going to send an evaluation form, and I'll put our funding opportunity in there too, since it is due in like the middle of August. But evaluation form, please fill it out. We really want to hear what you think. We want to make this learning community the most valuable it can be. So just please let us know.
Yeah, please look in, I'm sorry, Sarah, please look into the funding opportunity. It's $15,000 over 10, 11 months, which isn't a lot, but you can do a lot with that. So we definitely want to get some applications. We want to help you all, help your communities. Again, it's based on the roadmap. So there's, not just the 3 strategies we talked about, outreach, education, but there's strategies related to data or educating healthcare folks, or, collaborating with tribal leaders. So I think there's something for everyone in there. If you have things your program, if you're just starting out, or if you have directions you want to go in, please look into that.
And so that is my email. Email any questions, but yeah, I will be sending an email right after this. So you'll have my email there, and I'll put Carrie's contact information so you can let us know. We can put a copy of the slide deck on our website as well, which is just that NIHB.org/brain-health.
And Sarah, can you send out an email to everyone who attended once we get everything posted?
Yes, yeah, I can do that as well. But
hopefully we can do that.
Our learning community. Don't want to run too much more over time. So thank you everyone who joined us today. Hope to see you again for our next meeting, which should be, we're doing them bi-monthly, so it'll be in September, sometime in September. So look out for those emails as well. All right.